I don't know if we've got everyone quite logged in yet, but we'll work with what we have here. This is Monday, March 8th, 2021, and I am Amy Leone. I'm the city manager here, and I'm one of the members of the Yankton Health Board, and I'm joined by Mayor Nathan Johnson and Dr. Mary Milroy, also joined by Dave Mingo and Brad Bees, who are ex officios from our Community Development Department, Commander Jason Foote. And it looks like Ross is not here at the moment, but Ross Denherter, our city attorney, may log in. So there's nothing new on the agenda for anyone to be aware of, but I did want to visit a little bit about our metrics. And I emailed those to the health board members just a minute ago, but I'll discuss them a little bit here for the public's benefit. And I will share them this afternoon with the city commission. It looks like we'll start with the right-hand side of the chart. Actually, it looks like our active cases have gone up a bit. We're still manageable here, much better position than we've been in the past, but they are up a little bit over the last couple of weeks. And we're at our goal achieved for hospitalization. So this morning, Avera Sacred Hearts reports only one hospitalization of a COVID-19 patient. So those things are looking pretty good. Have not attained the goal that we had set forth for the active cases, but hopefully we can get there. When you look over at the vaccination rate, it's increasing. So we're fortunate to report that we have 18% of our population with both doses, and then an additional 11% of our population with one dose. So we're inching up there, which is a very good thing to see. We certainly want to see more and more people access that. Now, I would let the public be reminded, and I'll tell the commission tonight, that we believe that the pharmacies that are part of the federal pharmacy programs are reporting to the state number that they're getting vaccinated. We do not believe at this time that state number is getting reported or broken down by a county to add into our local county numbers. So probably this number is a little bit better than what this looks like. And we know that just because we know some people who have taken advantage of the private pharmacies and the federal program through the private pharmacies. Another element to play in here is the same would hold true for folks that are accessing veteran services health, whether that be a vet's hospital or a different facility that they're able to access a vaccination. We do know of folks who have been successful there with getting vaccination, or Indian Health Service, or something through one of the tribal organizations. Those are getting reported to our state. We're not sure if those then are coming back through our county. So probably this number is a little bit better than what it looks like here today, but we're just going off of what the state's reporting, and I'd rather edge on that side of caution rather than to overestimate what we have for vaccination.
I think we'll have more good news on the vaccine front this week. We've gotten a larger allocation than usual for Avera. So there'll actually be 840 doses going out this week. And that's hopefully to mostly get us through that 65 and above and the underlying medical condition population. So that will be huge.
Yeah, that's also great news. The only other, I guess, change in information is, I'm sure people saw, we did share this on our Facebook, but it's out all over the national and local news, that the CDC has provided some guidelines now for folks who are fully vaccinated I don't think it's anything so groundbreaking that we hadn't probably thought of it already for those people who are through their full course of vaccination and past their 2 weeks since their second dose. But it does give a little bit of more clarity to people, I think, about what is safe to do following vaccination. So, you know, those are available. We've pushed some of those things out through our social media, and we'll continue to talk about those things, and I'm sure more information will come out. Mostly right now they're talking about small group get-togethers, you know, two fully vaccinated people getting together from different households okay now, and that type of thing does not address workplaces yet, does not address some of the other things. Still has some cautions about group environments and travel. So that's unnecessary. So those things are still out there. And people can take a look at those as well. That might help guide folks once they are vaccinated to kind of gauge and make decisions for themselves. But I really don't have any recommendations for the city commission this evening when I talk to them about the metrics, other than just to encourage the community that we continue with our protocol. I mean, regardless of what happens with the pandemic here, the protocol of hand washing and good hygiene and staying home when you're sick, that's good advice anyway. So I think continuing with the protocol, and then just being mindful of how conditions change with vaccinations, and being apprised of what the CDC is saying is okay and not okay, and then encouraging people to sign up and get that vaccination when they're eligible to do that. Other than that, other than sort of more outreach with the community, I don't really have anything else to share. But certainly if other health board members or ex officios do, I'd like to discuss that.
I would just agree with you, and certainly the numbers of vaccines in the community, that's certainly very encouraging. I guess my only caution is that we all do need to adhere to safety precautions. And even if the CDC is relaxing some small gatherings with vaccinated people, the wearing of a mask in public places is still highly recommended. Distancing and hand hygiene, all the things we've been saying all along, have not been dropped. And I think our numbers are good. We're going, you know, we have a little increase in our numbers. But you know, it's I think the community is doing well, and our vaccinations, I think, will help. And let's just not let our guard down too early. You know, I think there were just some recent recommendations as far as that too. Just stay the course. You know, the end's in sight. Let's not drop our guard too soon and end up in a problem.
Yeah, Andy Slavitt, who helps with the White House vaccination effort and is from Minnesota, actually. I saw a tweet from him last night saying, you know, a runner doesn't quit running just because the end of the race is in sight. You got to keep sprinting till you get across the finish line. And that's where we're at now, where, you know, we can see the finish line in sight, but that doesn't mean we can just give up everything we've been doing to get this far. So I appreciate your comments, Dr. Milroy.
Let's see what our ex officios have to say and what they're learning in the community. Well, I'm going to pick on Ross because he must have been doing a lot of research for this meeting. That's why he came in late.
My feelings are that I've noticed about town in different types of stores, there's been a much more obvious lack of masks, in my opinion, which for me gives me a little bit of heartburn. But as long as our numbers stay low, I guess we can just keep harping on it. But it's clear to me that the elimination of the ordinance had a a direct and visible impact on the wearing of masks. So I think it's all the more important that we keep an eye on our metrics. I mean, I could get strung up in the town square by suggesting that we put that back into effect, and I'm not suggesting that right now, but it did swing noticeably in the other direction. So I just wanted to throw that out there for the group.
Thanks, Ross. Brad, how about from your perspective?
Yeah, nothing sort of earth-shaking, different than what you folks have talked about in the direction. I am probably more than cautiously optimistic from the things that I read and see that we'll see in the next month or so. I think we'll see of a significant increase in our ability or the healthcare and the pharmacy's ability to meet the needs of a lot more individuals. And I think that as that vaccination number pushes up alongside of folks we know who probably have some immunity from having had COVID-19. Again, I'm not encouraging that we forget all about the pandemic, but I am encouraged that I think it's going to move us in a direction where transmission is less and less likely, and that's ultimately a really, really good thing.
Thank you. Mr. Mingo, would you like to add anything here?
Not much else to say. I think the nice weather has people outside too, which is going to help us because it's pretty easy to social distance when you're out on a 70-degree day. So hopefully that, along with the increasing vaccination rates, just continues to move the needle in the right direction.
Thank you. Commander, do you have anything that your people are seeing in the community?
I just echo what Ross had said earlier. You know, there is a less mask wearing that we're seeing, but I did also notice, you know, as I went through town, and there's several businesses that still have a mask requirement when they go in. It's just some people don't abide by that requirement. So it's good to see that the businesses are still requesting the people wear masks.
Thank you. We do have a sign available that's a request. It just says, please wear a mask. So we've been saying it's the ask to mask type policy that is available for people that want to put in their home or business. And we have them up here in City Hall. Of course, not required anymore, but we request that people do that. Until we're more, fully vaccinated as a community, I think we'll see that. The only other thing I would suggest, and this is, to folks who want a vaccine but might not have the technology to get signed up or may just be uncertain as to how to do that. Our library is helping people connect with services, so and has a good understanding of. They've been in connection with Liz Healy at the hospital, but also with the pharmacy. So they have a good understanding and a good handle on who can sign up when and for what reasons. And they certainly won't pry into your medical conditions. But if you're just a person who is just a little bit lost, which I can understand how that could be as to where to go or what to do, we can help you out at the library. And so folks can give the library a call and they can help connect them. Other than that, I think there's no recommendation, so we haven't conducted any business other than just discussion, and I'll pass that along to the City Commission. So without anything else, I will have one of you two adjourn, and we'll be on our way.
So moved.
I'll second that.
Okay. All in favor of adjourning the Health Board meeting of March 8th, signify by saying aye.
Aye.
Aye. Okay, that was unanimous. Thanks, everybody. It's nice not to have anything to report for a while.
Take care.
Thank you.